I'm Kenneth W. Goewey, running for Governor of New York State in 2010. But today I want to talk to you about my third option healthcare proposal. And what it does is it's already established, and the other elements in my plan are already established, so we have known quantities that we are dealing with. The HSA, as people have been talking about, is a health savings account. And what that is in layman's language is a medical IRA that you control yourself as an individual, and it's an account that is dedicated to your medical expenses, anything that is health related. What most people don't realize or know about the health savings account is that the contribution is capped at $3,000 per year. Now, as many of us know, healthcare coverage for those that are purchasing it is ranging in the area of $800 a month with a yearly cost of just under $10,000. So immediately we have a savings of $7,000 in expenditure out of the individual's pocket. The next most important part is portability. That means that you, the individual who owns the health savings account, owns the coverage, and it goes with you wherever you go. The government doesn't own it, your employer does not own it, you own it. And this is a vital part of what needs to change in healthcare coverage today. The next element of the plan is self-regulation. You're not dealing with any bureaucracy, you are your own bureaucrat. You spend the money, you approve the care that you want. So it's self-regulated. The next item is that we finally have a plan that deals with prevention. Instead of trying to catch up with a disease after it's well implanted in our system, we're dealing with the disease on an ongoing basis by building up your immunity in your body's defense system. And this is very important because it minimizes something like the swine flu, for instance, where you've already got a good, vibrant immune system to take on whatever the disease that's going to attack your body. It also will allow you to use anything that is health related to be expensed out of this account. You can buy a toothbrush, you can get acupuncture, you can get any number of treatments that are not now presently covered. It will cover the vitamins and the supplements that you are now using and paying for out of pocket, which probably more people than ever in the United States are doing at present. An important restriction that has been built into the HSA as it is presently written is that it caps at age 65 to push you into the next federal government program. We need to change that with legislation and make this a lifetime HSA program. The beauty of this is it requires no bureaucracy. We have a known cost, and we have a far better outcome as far as what the customer is paying for and how they're able to control what's going on in their lives in terms of health, nutrition, and disease. The last most important part is the catastrophic insurance coverage in the event that you had an event with cancer or some other major disease. You can buy a high deductible, $2,000 deductible insurance policy to cover these events. This all would be expensed out of the $3,000 per year that you're able to use in the health savings account. The beauty of the HSA and the other appendages which I've described for you provide a complete package, and none of the bureaucracy that has been what we've had to deal with now and in the future. The expense is cut dramatically, and the control over your life is placed in your hands the way it should be, not in someone else's who knows nothing of your life and how you want to live as a free American.